Okay, I think I'm live. Yes, I am live. Welcome, everyone, to the Dish on Aging live stream. Let me see if anybody else is there. I know that it is early in the morning. Let me see. Edit, say something. Okay, well, anyway, here we are. Today is Monday morning, August 16th, 2021. And what I am doing is I am taking the Dish on Aging program that usually I post once a week. I just noticed my eyeliner's off, but anyway, the things you learn on the first day out here. So I have been posting, except for like the last 4 or 5 weeks, weekly pre-taped and edited presentations on topics related to aging. Hey, if there's anybody out there, say something. You have to type it in. Oh, good. There's at least one person out there. Okay, good. So I have at least one person. Okay. I'm trying something new today. Okay, so news just popped up. Not interested in that. Okay. So there's at least one person out there. I don't know if that one person is me. Okay. Okay. All right then. So my idea is to talk about topics related to aging and mental health. The reason why I am moving forward with this live stream is because we're having an uptick in cases across the United States, even local here to the Philadelphia area. And I wanted to try to get ahead of where we were this time last year, also when the pandemic started, where many of us became overwhelmed, anxious, and confused about um, just how to get through our day. And we all have enjoyed a couple of months in the summer of being able to get out and live our lives again. And many of us were anticipating that on the 4th of July, we would be able to declare our independence from this pandemic. And then we found that that did not happen. And here we are. So I think now I have two people on. Third person came on and then went off. So I hope everybody can hear me okay. What I'm going to try to do is test this and go into my own YouTube and try to test it. So I want somebody, if you can, to type in your chat. You will have an opportunity to type a chat button so that you can ask questions. Otherwise, I will talk about just general topics related to what it is that we're facing. Oh, good. Somebody just came on, Carol. Carol, type in a question. What do you want me to talk about today? I have all kinds of ideas. Well, Carol is coming up with an idea. I'll talk more about the purpose of today's video. If there's one thing that we know about psychology is that taking action, I heard that Montgomery County is in deep trouble with regard to what can you tell us about that? I actually don't know. Montgomery County actually last week actually has the state record for 95% of eligible adults are vaccinated. I think that what might be coming ahead is we are, what are we, 2 weeks away from school starting? Yeah. A lot of the local schools are starting on August 30th. And if anybody is in deep trouble with the Delta virus, it's primarily the unvaccinated. Some were listening to me talk about, dare I say, even complain about my cold symptoms last week. I did get a COVID test. It came back negative, and I was so pleased because I was trying to figure out, even as contagious as this Delta virus is, I have been fully vaccinated. Yes, we're hearing that the Pfizer vaccination, it's holding up, but not as well to the Delta. And also what we're finding is that, oh, and the Moderna is doing beautifully, holding up beautifully with the Delta virus. What we're also finding is that Pfizer made a statement last week that separate from the boosters for the immunocompromised individuals, that probably everyone will need a vaccination booster to be able to handle particularly Pfizer is it's still working, just not as strong, and we don't know what's ahead with that. So I fully vaccinated, as I imagine most people are. We did good. Those of us who are over age 50, those of us who just are really concerned about this, we are fully vaccinated. 3 weeks ago, I started wearing my mask when I go out again. And that's why I was so confused about having cold symptoms all week and decided I don't want to have to worry about this. Let me get tested. And I did. And everybody knows just because the test comes back negative, they said, if you continue to get sick, go get tested again. I'm feeling better. So great question, Carol. I don't know what's happening. Overall, in the Bucks County, um, Montgomery County area, masking up. Okay, I'll get to the masking up question in a minute. Even though we're having upticks locally, we are not having the same type of avalanche of new cases, particularly younger people, that we're hearing about from Florida and Texas. Keep in mind, a lot of those southern states may have had 25-30% of eligible adults vaccinated. And so when the Delta showed up, it's going through those communities like wildfire. They're actually having greater challenges in Florida and some of the other states, more so than they did the first round in March, April, May, June, July of 2020. We got hit really hard up here in the Northeast. Florida during that time, not so much. And I remember at the time trying to figure out, how is it Florida? They didn't shut down for much more than 2 weeks. I don't even know how many months in 2020 we were shut down here in the Philadelphia region. And it seems to have helped at that time before vaccinations were available. And I was speculating that the state of Florida had beautiful weather during those months, and maybe it was being outside was helping to protect and reduce the spread of the COVID. And sure enough, they're saying because it's summer months, Floridians and those in the southern states are going to be inside in the air conditioning more often than not. And so the summer weather may be contributing in addition to the Delta. So in response to the question, do you think we should all start masking up? Yes, simply because it's not going to hurt. There's a list of local stores that's now asking people to wear masks, whether you've been vaccinated or not. Also on Friday, the City of Philadelphia Health Department made new regulations for mandating vaccinations for all healthcare providers. That may start to have an impact on the home health staff in Philadelphia and some of the nursing home staff in the region who have chosen I don't know what the numbers are now, anywhere between 40 to 60% of nursing home staff are choosing not to get vaccinated. By the way, it's one of the reasons why I had wanted to go live stream with this video today. I was initially going to wait till after the Labor Day. And what's happening is they're getting new cases of COVID in the local nursing homes, and that is leading to they have to follow the Medicare protocols of they're back to no visitors and all the residents have to stay in their rooms. So the action going to be focusing these videos on action each one of us can take during the day. Taking an action, no matter how big or how small, can do wonders for our mental health, particularly when we are in a situation where there may be things going on around us that are completely beyond our control. We have absolutely no control over whether or not those around us get vaccinated. We have no control over how many variants come out. We have no control over how we are going to be impacted as we go into the fall and winter this year. What we do have control over is our action in our own little world each day. And so each presentation, I am going to be talking about actions that we can take to help us to stay emotionally strong and as anxiety free as we can be. And the action that I want everyone to be thinking about taking today is what is something constructive you can do today um, that is positive and constructive. And I'm encouraging anyone who may have a friend or family member who's living in a long-term care facility. A suggestion might be reaching out with a phone call because they may be back to staying in their rooms all day. And so that can be positive and constructive. Also, something positive we can do when we go out is to wear a mask, whether we have been vaccinated or not. Oh, by the way, the reason why the County of Philadelphia Health Department came out with new regulations specific to the city of Philadelphia is because the city of Philadelphia vaccination rate is only at 50 something percent. So it is fairly low compared to um, some of the other counties. And so the health department in the city of Philadelphia made the decision to implement some, I don't know specifically what their mask ruling are, but they are implementing some vaccination mandates. So people will have to get vaccinated or they will have to submit to a once a week COVID test. And I went for my first COVID test last week. It's really not bad. I didn't get one of those kind of tests that goes way back into the nasal passage. It was just taking a sample from the inside of my nose. So some people may opt for that. Also, anytime we have had vaccination mandates in healthcare, as healthcare providers, and those of us specifically working in long-term care are required to get flu shots every year. There's always a medical and religious exemption. Just so everyone knows, if somebody has a medical condition that their doctor is telling them under no circumstances can you get vaccinated, even though their doctors are saying probably saying because of your medical condition you absolutely should get vaccinated. But if somebody has a medical condition, they're not going to have to get vaccinated or lose their job. There always have been medical and religious exemptions. We should mask in. Okay. Good. Okay. Looks like I have one person on today. So we had two people check it out. Here's what I'm going to do, Carol. I am going to Google what's happening with Montgomery County. One of the things that I had wanted to do today also was to demonstrate how to find information. I was anticipating that some of the questions, and I'm sure some of the questions that will be coming up will be related to how to find resources, how to find help for somebody who maybe needs help around the home, how to help someone find meals, help with shopping, maybe even help with paying some of their bills. And many people now use the internet and do a good job with using the internet as a resource. And with that being said, sometimes it can be a challenge to know what websites to go to find reliable information. What I just Googled now is Montgomery County COVID. I'm going to the Montgomery County official website to see where we are. Testing, vaccination. It's giving information. Oh, good. Not just about where to get tested, but also information about how to get rent and utility help if somebody's having trouble paying their bills. County COVID. Okay, so I'm just Googling now to see what news stories may have come up. Montgomery County, PA, COVID. Okay. Yeah, just Montgomery County, what's coming up. Montgomery recommends that the general public wear masks indoors, and also any county buildings. So I think they're just being on the safe side there. But like I said, because the masks are so important, Montgomery County is going to fare better than some other counties. Oh, okay. Oh, they're a hotspot. Okay. Someone just typed in Montgomery County as a hotspot. That's surprising. I'm going to follow that, and I'll talk more about that on Thursday, because that is really surprising, because Montgomery County made the top best in the state for 95% of their residents are vaccinated. I wonder if it's the kids. Huh. I'm going to look into that. Okay, Carol, looks like it's just you and me here. So you get Ask the Psychologist format free. What's your next question? I think Monday morning is I know that this is a tough time, 9 a.m. It might be too early. I think it's, yeah. I'll check channel 6, actually. I will do that while I keep you here. I think everybody is sleeping in today. This might be too early of a time to have the live stream. Yeah, they're today, this morning, Montgomery County mask requirements are going into effect. Okay, top stories, mask requirement for Montgomery County. Okay. Oh, good. I'm so glad the quality is good. Yes, I I know. I was working on that this weekend. As time goes by, I am learning how to keep the live stream going with a strong internet connection. For a healthcare provider to be running, yeah, I am too. I'm glad my COVID test came back negative. It was also pretty quick. They run the tests during the weekend. For those of you who might hear, my dog is out there barking. Probably another dog is being taken for a walk out there. So this is really unprecedented for a psychologist to, or even any healthcare provider, to set up a live stream question and answer session open to the public. And I haven't had a lot of time to market it. I think as time goes by, um, we'll get more viewers come on. And I was also running it past some of my peers. They thought it was a great idea. They had some concerns. They want to make sure that I present just information and not try to set up a group therapy type of environment. And I said, oh no, this is live stream YouTube. It's not like if we were on Zoom, it would be more of a group interaction. And my biggest concern with today was going to be losing the internet, and that still may come up. I'm so glad that so far so good. And also, this presentation will post on my YouTube, the Dish on Aging channel. It'll post tomorrow. I've had somebody, I don't know if it's the same person or different people, coming in and then going out. So somebody might be coming in and then losing the connection. I don't know. There's my webcam. There's my live stream. Trying to learn all of my positive. Yeah, I'm not I probably, did I say the wrong thing? My test came back negative. Okay. I'm still trying to figure out all of this live chat, learning as I go. Oh, I just found participants. Good. Okay. Good. All right. So what are some positive things we're going to do today? Any ideas? I know we all did something positive already. We all got up early for the live stream. I'm sure I will be walking the dog. And let's also do the best we can today. Let's focus on being as socially interactive as we can with other people. I want us to start thinking about storing up positive vibes and connections as we are getting towards the end of August. We can put our masks on and have confidence in our vaccinations even just locally in the building where we may live, or in the community, just going out for a walk. I don't know what the weather's going to be today. Okay. Yeah, I do too. I may not know how to work a live feed. I know. Oh, did you just? Okay, now it just says you just dropped out. Okay. And I am glad we're having this test run as well. And I think you're right. Everybody may be learning how to set up the live stream. Okay, looks like you just came back. Oh, okay, good. Yeah, you're glad I'm not positive. I am too. One of the things that I learned is that I felt, it can be scary when we're turning the television on and we're getting all this information. We're hearing some super scary things happening in those southern states, especially with pediatrics, younger kids. There's also going to be a lot of uncertainty about the kids going back to school. These unfortunate, very strong reactions that parents are having about mask mandates for the kids in the schools. All that contributes to generating a whole lot of anxiety. Well, I just went out and picked up everybody's empty, the recycle bins and trash can. Oh, that is wonderful. I have a shield of positive white energy protecting me today from negative thoughts or people. That is wonderful. That is what a wonderful thing to do also, to collect the recycling um, and garbage cans for people after the pickup early this morning. That is wonderful. So we can expect that as our week goes on, sometimes it can be helpful if we plan for anxiety or know that we'll have anxious days, and then if we start hearing things that make us a little bit anxious, if we start seeing that other people are getting anxious as we get closer to the start of school, I think that our whole community, even those of us that don't have children or may not have grandchildren even going to school, um, it's going to be, I think it impacts our whole community because the school system is a big part of how our communities run, particularly with a lot of people are out of the labor force because they're home with young children. And as I was saying a good month ago, that we're very short staffed, not just local, but across the country in long term care facilities and hospitals, doctors' offices, and everywhere. And what I was saying about a month and a half, 2 months ago, I was telling people, hold, just hang in there. September, when the children return to school, the expectation was at that time that we would have a return to the labor force and that some of the long-term care facilities would be back, getting closer back to their regular routines and schedules. And I saw over the weekend that Governor Murphy in New Jersey is preparing his community for the possibility that sometime in at the start of the school year, they may have to make decisions about going back to a hybrid model. That may put parents on edge. It's no doubt going to put the students on edge as well. That is the reason why for us, I like to think that we get wiser as we get older. And as we are, uh, it's going to be important for us. I'm going to call everyone over age 50 as being sort of the older and wiser members of the community. If we can figure out how to manage and stay positive as this really the nonsense of the pandemic, just the pandemic itself is a bit of nonsense. If we can find ways to continue to stay positive and constructive, then we're going to be able to set an example to others around us. And that is going to be very important because it's going to tend to be the younger generations that may be most affected should the young kids not go back to school. I just remembered the other part of the city of Philadelphia Health Department vaccination mandate on Friday. Um, in addition to every healthcare provider mandate vaccination, the city of Philadelphia also said every college and university, every student, every employee must also get vaccinated. Um, and just the thought of if someone, I've always had such respect for the concerns and anxieties that people can have about getting vaccinated. I didn't have any. Of course, maybe 30 seconds before I got my first vaccination, I was a little nervous about it. The reality hit me. This pandemic is so new. They know that the vaccinations will keep us out of the hospital. The vaccinations will really protect our lives significantly. At the same time, they don't have 10, 15 years collected research on this. And so also, some of us will have had positive experiences with interacting with the healthcare system. I happen to be someone who's fortunate every time I've gone to the doctor, to the healthcare system over the course of my life, I got better. There were always positive outcomes. And I have friends who sometimes they went to the doctor and they were given a misdiagnosis and then treatments went the wrong way. And I know people who've ended up in intensive care just because of a bad reaction to a medication that their doctor fully expected would be helpful and not cause a significant problem. And so there are going to be individuals out there who have had, or people close to them have had one of those bad experiences with before the pandemic with the healthcare system, and they're going to be fully justified in being um, suspicious and uneasy with a getting a new medication. So I've always had a lot of respect for the anxiety about that. The good news is that we've been 4 or 5 months vaccinating, and for some individuals, when there's a work-related mandate to get vaccinated, most people do go get vaccinated. There will be a handful of people who will choose to leave their jobs because they feel that strongly about it. And the thinking is that with vaccination mandates in certain sectors of the labor force, that will also help people who may be feeling peer pressure at home. If somebody's living in a home where everybody is staunchly anti-vax, just because they're uncomfortable with the newness of the vaccinations and so on and so forth. If work requires it, it may give somebody who's on the fence a chance to go out and say, look, I'm uncomfortable with this and I really do need my job. And so they can kind of go out there and get vaccinated. And I think every single one of these um, vaccination mandates to stay employed also allow for a once a week COVID test. So that's also another option. Would never drop out. Oh, no, no. No, you can drop out. This presentation, Carol, is designed to be a drop in, kind of like a very light question answer. Somebody may drop in, just ask a question, and 5 minutes later leave. That's kind of the design of this for Monday at 9, Thursday at 2. Somebody might be going through their day and watching television, almost like channel surfing, and on their TV they can go over to YouTube and they might want to see what's Dr. Sweeney talking about. And it may be a topic that is of interest to them. It may have nothing to do with them, and so they may switch out. So yeah, I'm perfectly comfortable. The design is for people to come in and go out. When I'm on Zoom and other video meetings where we're all looking at each other, um, the flow is to fall out, because especially when I'm on a national call, somebody's local internet can fluctuate and it drops them out of the call. Video, I guess, uses a lot of internet, and so if there is a fluctuation in the internet connection, the first thing that drops out is the video. Sometimes the audio stays and the video goes. So yeah, no, that's not rude at all. I invite everyone to come and go. That's the design. I want this to be just laid back and helpful, and so that each person can use this presentation how it works for them, how it's comfortable for them. No, I would never drop out. Okay, there's a shortage of bus drivers for. Oh, yeah. I'm actually not. Glad you brought that up. A shortage of bus drivers for the schools. When you asked the question much earlier, Carol, about Montgomery County getting hit, the first thing I thought of was healthcare. What I think there's no doubt, whatever wave we are now with COVID, we're in a situation where the rules are starting to change as we're getting into the fall year. Our communities are focused on getting the kids back to school. And let me tell you what's happening. The demographic of those who are vaccination hesitant is very specific. It tends to be lower levels of education, Black and brown, Black, African American, Hispanic background. Also, some immigrant, large groups of people that are vaccination hesitant are also more recent immigrants. And it tends to be in the nursing homes, and this is how it has been since the vaccinations come out. So the individuals who are choosing not to be vaccinated are tending to be those working as the nurses' aides, the housekeeping staff, and dietary. And it tends to be the RNs and the physicians and the other providers like myself who are vaccinated. And so it's going to be the lower education jobs also that cannot be worked from home that are going to have the shortages. I can't tell you how it's been the whole year, but it's gotten bad. I think especially since the summertime in the long-term care facilities. I continue to do the work I do from home. I'm 100% video still. And so I will be connecting and talking with people who are living in a variety of long-term care settings. And the staff shortages have been, on a national level, they're being called almost crisis, because it tends to be that lower paid jobs of people of less education that are going to be more hesitant to get vaccinated. It's also going to be, that's going to be the group of people that is home with the young children as well. Some of the factors were also the additional $300 a week of unemployment that has stopped in Pennsylvania. I think it like runs out. I think second week in September or something, but that had the extra unemployment dollars, the extra 300 a week, even though the federal government is still making that available, Harrisburg has voted to stop that in Pennsylvania. And the challenge is, and this is a conversation that will continue after the pandemic is over, and that is very low paying jobs. I mean, what does it say if you make a lot more money um, collecting unemployment than you do working? And also, when you have young children and you can collect unemployment, get an extra $300 a month, and then you don't have to pay for daycare for the kids over the summer months, it's a disincentive to go to work. And some of the labor on a national level, some of the labor statistics are showing the number one reason why people are staying out of the labor force is to care for the young children. Yeah. Yeah, labor shortages are going to be a challenge. It's also going to be a challenge um, in the hospitals as well. The hospitals are having some staff shortages. So next question, Carol. This is all falling on you here. I'm going to see how Thursday goes with to see if I have a feeling the afternoon time is going to be much better for people. I also think we may not need the whole hour. So I actually may change that. Now I know what they say on television. You're not supposed to have dead air. It's hard to fill up an hour. Um, but I've covered a lot, and good. I actually may look at my schedule. Hmm. Okay. All right, Carol, here's what I'm thinking. Why don't we end up early? Give it a thumbs up or whatever. I think 40-minute conversation is good, and we will see how next week goes. And I think we can call it a day. And I agree with you, Carol. I think this was a wonderful run through. I think I got rid of some of my anxiety. And I'm looking forward. Next time in is Tuesday at 2 o'clock. And I will make a decision. I may go for shorter time period. I wanted the whole hour so I could talk about sometimes questions related to psychology and aging require more of an explanation. Um, some of the most common questions I receive are somebody's not sure how to connect with applying to get help with funding for home health services or how to find a psychologist. And some of those questions can take a little bit longer to explain the complexity of the senior care system. So, all right, looks like we have somebody else on. We now have two participants. I can see numbers, just so everybody knows. I can see numbers, but I don't know who you are unless you ask a question. So here we are. But I am seeing the number 2 up there. So I do have somebody else on. So today was a great day as we talked about, you know, just how to stay positive, to do active things each day. Suggestions, as Carol did, doing nice things, good things, helpful things for neighbors. And yes, whether we have been vaccinated or not, wearing masks are a good thing. They're not going to hurt, and there are going to be um, locations, buildings that are going to insist on them. The doctor's offices always have. Some of the official public buildings, for example, courthouses in Doylestown and township buildings are going to be requiring masks. Doesn't matter if you've been vaccinated or not. And that's going to be a good way to move forward. It can also feel like it can be disheartening. It can feel like that we're taking a step back, that we're backtracking. And the answer is yes, we are. We did everything right here. I'm going to keep saying this here in Pennsylvania. We've relative to other locations, we're not the best, but we've actually really done well with getting a high percentage of people. I'm sorry, like I said, Montgomery County is 95% of eligible residents, the best county in the state. Bucks County was at 68%. This was about a week and a half ago, and Philadelphia County was low 50%, 52, 53%. So, and all along, we have just done a really nice job, I think, as a community in doing what we're supposed to do to try to combat this pandemic. And what has evolved over the summer is this Delta variant this is the nature of viruses. I tell you, you probably are like me in the last year and a half, we have learned more about viruses and their mutations than we ever wanted to know. We didn't need to know all this, and now we're learning about mutations and why they're important. And sometimes it feels like our entire communities are like living a science fiction movie. I know it's almost surreal sometimes, and the reality is that the Delta variant is a game changer, and mostly also because the children younger than age 12 do not have vaccination eligibility. Also, I've been learning more about the breakthrough cases. They are very mild, and when the FDA announced on Thursday. Okay, so I'm live and I'm going to answer the phone. Hi there.
Hi,
Yes.
hi. Carol.
Yeah, I know.
I'm watching you, and I have typed in 3 questions since you asked me to send questions over, and it looks like they're not registering on your end.
Oh no, they are. I had to scroll down. Just so the
Okay.
viewers know, the person who was typing I'm talking to on the phone, she said I'm not getting her questions. So I just saw them. Thank you for calling. And
Yeah,
I'll go.
that's what I wanted to, and it's hard because I'm here and I'm frustrated, and I'm like, I just sent 3 questions, and
Okay.
I heard that you had heard a ding or something when a question would come in.
Oh, that's a good that I'm going to have to set that up.
Maybe that's something you can turn on. But anyway, let's look at our regular sessions. But I thought this was a good test run anyway.
Good. Yeah. Let me
Okay.
go to your questions then.
Okay. All right.
Thank you. I had a viewer a little frustrated because she's been typing in questions and I wasn't seeing them. And the reason why I wasn't seeing them is because I wasn't scrolling down. So I'm learning as I go. Oh, by the way, just so everyone knows, I've never been a tech person. What I have learned as a healthcare provider over these pandemic months is how to operate video, how to interact to provide healthcare services. I was not, even though this was available and some providers had started using it a little bit, I never had. And I've actually been having fun um, venturing out and trying to um, work the bugs out of things. So here we are. So the question was, I just hope, yeah, I hope we don't go. You know what? I don't think that we're gonna have to go to lockdown again. Um, and the reason for that is because so many of us have been vaccinated. And I think that the combination of vaccination and wearing a mask is going to get us places. The challenge is going to be the unvaccinated. And I think also what could come up in healthcare systems and other places of employment is, for example, if a child tests positive, let's say a 6-year-old goes to school, tests positive, I'm are the same rules in effect that the parents can't go to work because they're living with a family member who tests positive, even though the parents are vaccinated? I think I just in my own head answered my own question. I think the vaccinated can go to work, um, even if even though they're living with somebody who has active COVID. I just answered my own question. Um, but that I think that that's what's going to start to happen is some employers also may go back to putting on hold back to the office moves. I think it's just going to extend kind of this half and half place that we have been at all summer. I think going on. Oh yeah, nope, no lag, just uh, nope, I don't hear a ding. Okay, so yeah, so I mean, I don't have a magic, what do you call it, a globe that I can see into the future. Um, but here's what one of my concerns is, and the reason why I wanted to start this project of live conversation, question and answer, is because people living in long-term care, this is going to have a big impact because Medicare has their strict rules. If anybody tests positive, whether it's staff or residents, the whole building has to go on shutdown to prevent any further spread. And again, long-term care has a high percentage of unvaccinated staff. That will change in the city of Philadelphia. There's no mandates in most of the facilities in the suburbs of Philadelphia. So I think that is going to be one of the biggest challenges that will impact some families. Also, what was happening this summer, there were families who wanted to start to get home health um, for a somebody at home that was starting to decline and need care, just decline just because they were getting older. And the families are now saying, there's no way in heck I'm going to put my dad in a nursing home with the possibility that I won't be able to come in to visit him, even if that's for a short period of time. So more and more families are providing the elder care services at home. And when they reach out for help from some of the agencies, some of them, not all of them, but some of them are saying, look, we're running so short staffed, we can't take on new clients at this time. So that's been the challenge. I think that's where we're going to start to be feeling it. The people that are living in long-term care settings, and then families who may need a little bit more help, and because of labor shortages, they're just not able to get it right now. But I don't think we're going to go back to lockdowns. And again, it's the Delta variant now. They're going ABCD, and then they're going Lambda. The other big issue with this pandemic is completely beyond our control. But one of the things that's happening with the pandemic is um, the variants that are happening. Look at the continents of India, China, and Africa. The vast majority of people don't have access to vaccination. So when, by the way, the Delta came out of the India outbreak. The Delta variant came out of that. So we could, let's see how often we get our variants developing in other parts of the world and then bouncing over here to the United States. I mean, we're just going to have to keep an eye on that. Also, we're going to have to keep an eye out on when do the rest of us get options for boosters so that the vaccinations we got can be even stronger. All right, then. Thank you, everyone. I guess I did go, well, pretty much the whole hour, but I think I'm going to end it up um, a little bit before 10 o'clock today. And thank you, everyone who has joined us today. I had a lot of fun. Um, and I look forward to Thursday. So, again, this is just a casual drop in, drop out, ask the psychologist questions and answers about how to anything about psychology and aging, and then specifically how to understand what's happening with the COVID so that the take home message is stay active every day. Find one little thing you can do that is positive and constructive, and that will protect your mental health. That's how you will stay healthy. All right, then. I'm going to take a short walk with the dog to be constructive. Okay, bye bye. I'll be live. Your stream will. Okay, end it.